As we age, we lose bone mass or density. Our joints become stiffer and less flexible, and we experience loss of muscle tissue and a decrease of fluid in our joints. These are all issues that cause pain and, at times, the need for surgery. With us today is Dr. Evan Lewis with Baptist Medical Group Neurosurgery. He'll share with us the common problems aging seniors face and when surgery may be necessary. Dr. Lewis, thank you so much for coming on today.
Well, thank you for having me.
To get started, share a little about yourself and your experience as a neurosurgeon.
Well, I was born and raised in Paris, Texas, and I went to undergraduate at Baylor University in Waco. Following that, I did my medical degree at the University of Texas in Houston. Upon completion of my medical degree, I was accepted into the University of Maryland neurosurgical residency, where I went to Baltimore and trained for 7 years, focusing on neurosurgery. During that time, I worked at hospitals like Johns Hopkins and University of Maryland Shock Trauma and the Baltimore VA system.
Wow. So for those who don't know, what exactly is neurosurgery?
Well, neurosurgery or neurologic surgery is the surgical treatment of neurological illnesses such as spine or cranial diseases.
Okay, and so what type of illness or disorder would typically require attention from a neurosurgeon?
Well, there's a lot of different subcategories. Like I said, brain and spine are what most people think of, and most people tend to think of cranial surgery as being neurosurgery, but neurosurgery is very vast. It covers kind of 7 major categories. There's oncology, which is related to tumors. There's vascular, which is related to diseases of the blood vessels of the brain and neck. There is spine, which is diseases of not only the spinal cord itself, but also the spinal column. There's peripheral nerve. There's pediatrics, which is dealing with neurosurgical issues in children. And there's functional, which is dealing with movement disorders and epilepsy type of procedures.
So tell us about some of the most common problems you see in your senior patients.
In the senior population, a very common problem relates to spine, particularly with degeneration of the spine or arthritis that develops as we age. We can develop problems such as sciatica or radicular pain, which is pain in the arms or legs, because nerves are being pinched or the spinal cord is being pinched. In severe cases, the spinal cord can be pinched and it can cause paralysis.
Oh, wow. So how exactly do our bones and our muscles change as we age?
So obviously, as we age, as a normal part of life in the physiology, particularly in bones, the skeleton is constantly being remade, whether it's the spine or the humerus or femur. The bones are constantly being reabsorbed and relaid so that you have a strong structural integrity of the bones. As we age, some of the endocrinology of the bones, we can develop things like osteoporosis and osteopenia, which is loss of the amount of calcium in the bones, which makes the bones more brittle and more susceptible to fractures.
So what are some things that we can do now to help our spinal and our neck health?
So in terms of helping your spine and neck health, one of the things that is best is trying to maintain an active lifestyle. Maintaining good core muscle strength with exercises, whether it be through formal physical therapy. I like to utilize aquatic therapy or water aerobics that really strengthens the core musculature around the spine, which kind of gives an extra scaffolding or buffer to the spine to keep the spine healthy. Other things would be to focus on staying in shape and not being obese.
Okay. Now, what are some signs or symptoms to look out for that we might require neurosurgery?
In terms of signs or symptoms, one of the things that a lot of people will have what we call axial pain in their back or in their neck. This pain is common, and it can be multifactorial. It's something to be evaluated to make sure that there's nothing worse going on. But the real indicators that something might need a surgical intervention would be radicular pain or pain radiating down your leg or arm, or development of weakness in your arms or legs. Or one of the very concerning things is what we call myelopathy, which is actual compression of the spinal cord. When the spinal cord gets compressed, it can cause you to lose some of your fine motor movements and become clumsy with your walking. In severe cases, it can progress to further overall weakness and paralysis. Those would be big signs to get evaluated for.
Now, I know a lot of people probably hear the word surgery and they get spooked. Are there non-surgery treatment options?
There's absolutely non-surgery treatment options. Like I said, axial back and neck pain is a very common ailment throughout the population of all ages. A lot of axial pain does not require any type of surgical intervention, and a lot of these interventions that can be done that aren't surgical are doing physical therapy. You can get injections to your spine. There's certain medications, particularly non-steroidal anti-inflammatories like ibuprofen, that are good to utilize, and some other types of muscle relaxant medicines. And occasionally other pain medications can be utilized to prevent the need for surgery.
Sure, sure. So say someone is, starting to experience some of those signs or symptoms you described earlier. Tell us about the resources that are available at Baptist and how someone can get help.
So at Baptist, we have a wonderful group of primary cares that kind of are the gatekeepers to a lot of spine health. But we also have a wonderful physical medicine and rehabilitation group that is also very key in diagnosing and treating patients with back and neck problems. But ultimately, within my group, we have 4 neurosurgeons at Baptist that are all very well trained in dealing with problems related to the spine and neurologic disorders. And so you could call our office for a referral, and it can be submitted by calling 850-469-0642.
Fantastic, fantastic. Well, it's incredibly important information. I appreciate you coming on and sharing it with us.
All right. Thank you.